everybody, it's Dr. Carrie Howe with Restore Pelvic Physical Therapy, and today we're going to talk about 5 common exercises where leaking might happen. Leaking is one of those things that's not talked about very much, just like a lot of other pelvic health and women's health issues in general. But if you're somebody who is looking to get fit and active, or maybe you're somebody who is already fit and active, but leaking is holding you back, it might be something you want to pay attention to. First off, it's common, but it's not normal. And secondly, you're not alone. We want to make sure that leaking is something that women never feel ashamed about or embarrassed by. But it is important to highlight that leaking, especially related to your fitness, is your body's signal that's telling you something's not working just right. At Restore, we work with women both pre- and postpartum who experience leaking with these 5 common exercises. Number 1 is running. Leaking can be very common when running. And while we think of it as a cardio or an aerobic-based activity, there is a huge single leg dynamic component to running. With that comes impact and forces each and every stride that you take. Your pelvic floor has to be able to work with your abdominals and your hip musculature to be able to absorb and control those demands in order to keep things up and in rather than leaking down and out. Number 2 is jump rope. This one is a biggie for my CrossFit athletes. Whether it's single unders or double unders, jump rope has a lot more up and down movement compared to running. Oftentimes with that up and down movement, that can lead to a greater impact force bouncing on the ground. Because of this impact, a lot of ladies' bodies and pelvic floors just aren't prepared for all of this up and down motion. It's not something we typically experience in our day-to-day life. There's a lot of breath work, positioning, in addition to pelvic floor exercises that we can do to prepare our body for this impact. And those are all strategies that we can get into in a future video. Number 3 is any type of calisthenic related to jumping jacks, hopping, maybe even burpees. All of these plyometric type of exercises are all pretty similar, and I'm sure you're probably starting to detect a theme here now with jumping, impact, up and down motion. There can be a lot of nuances in these different types of movements that create different demands from the body, such as a jumping jack, your legs are now coming out rather than just up and down. Regardless, these are all very highly stressful activities to your pelvic floor that might just require a little bit more attention for its and your own health. Number 4 is squatting. So whether you're into strength training or maybe it's deep squats in yoga, or if you're just a mom who's holding her baby sitting down and getting up out of a chair, squatting is a very important movement for your day-to-day life. Now, when we think about a squat, oftentimes leakage happens in that bottom position. And you can think about your pelvis in the orientation and the range of motion that is required to get into that deep squat. With that, pelvic floor can oftentimes be a little bit vulnerable in that position. I think there's a little bit of a misconception that when leakage happens, that means that our pelvic floors are just weak, and that is definitely not the case. You can actually sometimes be over-recruiting your musculature, whether that's pelvic floor, maybe your glutes, maybe your abdominals. Any over-recruitment can cause leaking, especially in that bottom position of a squat. And finally, number 5, the deadlift. So we've separated out the deadlift from the squat, much like we did with jumping and running, because again, there are a lot of different nuances and details between each movement. When you're performing a deadlift, you don't have to worry about that bottom position or that range of motion like you experience in a squat. But you're still picking up heavy load from the ground, and with that comes a lot of intra-abdominal pressure inside of your abdomen. That pressure can push down on your bladder and onto pelvic floor, and oftentimes women will experience the leaking as they're picking something up. So again, this is where position and breathing strategies can come into play to resolve some of these leaking issues. Sometimes it's an easy fix, and other times you have to work on it a little bit more. Again, because the demands are so much different between a squat versus a deadlift, we're talking different movement patterns. Some women might experience leaking with squats and not any with deadlifts, or vice versa. So if leaking is happening to you or anybody you know, or maybe you're not having any issues with leaking yet, but you're having a hard time holding it in, reach out to us. We're here to help. Again, all these pelvic health conditions are so underserved and under-discussed. That's why we want to bring light to some of these issues, because the truth of the matter is that so many women deal with these. You are not alone, and the biggest thing that we want for you to take away from this video is that there is help. Follow along on our channel for more videos to come of pelvic health. If you have any questions, find us at restorepelvicpt.com. You can submit an intake form, and we'll be in touch soon.